But he mentions two mechanisms, two reasons for the placebo effect. One is the response bias, the other is regression to the mean. And it's worth unpacking this idea of response bias a little bit more. If we go back to his example that he provided with appendicitis. So if you're a patient, you're complaining, oh, my pelvis hurts, and you go to the clinic and you see a physician, they're either going to decide to operate or not on the basis of the information they have in front of them, right? So there are 4 possible outcomes here, and we're representing it using a 2x2 table, a 2x2 contingency table. There's 4 cells. It's nothing fancy. But essentially, you either have appendicitis or you don't, right? And the physician's either going to decide to operate or not. So there are 2 ways of being right and 2 ways of being wrong, okay? So these have labels. So if you, in fact, have appendicitis and they decide to operate, that's good, right? That's a correct decision. That's called a hit. But if you have appendicitis and they decide not to operate, that's pretty severe. That's a miss, okay? So you have an inflamed appendix and they decide, oh, you're fine, go home, okay? Yeah, you could die, right? If this were serious enough. That's a